So can you give 3 practical examples of how people can reduce their lifestyle changes starting today? Can reduce their stress, with lifestyle changes starting today?
Yes, I'm so glad you brought it up. Let me preface perhaps by saying in lifestyle changes, some is always better than none. We don't have to go all in and beat ourselves up, let's say, if we don't exercise perfectly 7 day a week, Monday to Sunday. Some is always better than none. So my 3 tips, first one would be exercise. Recommendation wise, CDC recommend aerobics, which just means any exercise that increase your heart rate. In terms of how much should you do it, moderate intensity is best. So the quick way to check it would be if you can still talk during the exercise, but perhaps you can sing flawlessly when you're exercising. That would be the goal in terms of the level. Duration wise, they recommend at least 150 minutes per week. So that would be an equivalent of half an hour from Monday to Friday on weekdays. And the good news is in psychiatry and mental health, especially, even just one exercise session is enough, for example, to decrease anxiety, or just an hour of aerobic exercise per week, only an hour, can help protect against depression. My second tip would be to optimize your sleep quality. Some common things to avoid, first 12 hours before sleep, so let's say around noon, it's good to avoid caffeine. And it's not only found in coffee or tea, but also in things like soft drinks, energy drinks, soda, chocolate, and the likes. And then 3 hours before bed, if you could try to avoid having dinner, especially heavy dinner, uh, drinking alcohol, and exercising too close to bedtime, 3 hours before bed. It's also a good idea to put in an intentional stress time. And what that could look like, especially if you have a lot of things in your mind, is just try to list down your worries. And you could either on the next side by side, write down one simple step of what you can do tomorrow to work on that, or you can just simply tear down that piece of paper and throw it away. Simple. And then 1 hour before bed, it's important to avoid screen, just because, as you probably know, the blue light might interfere with the sleep hormone that interrupts your sleep, and also just try to relax your body, your mind in general. So ideally no work, no, not too much thinking within this 1 hour before bed. My third tip would be stress management technique. This is one of my favorite. It might seem simple, but essentially what we're trying to do is just put both our mind and our body at a calm, relaxed state. And my tip for this one would be deep breathing. So a few caveat, the breathing ideally would include your belly. So it's very deep and include your belly. And I'd like to also count while breathing. So I would count to 6 while inhaling, count to 6 while pausing, and then count to 6 while exhaling. Repeat this a couple of times, and that would help put both your mind in terms of less anxiety, better mood, and whatnot, and your body in terms of just your heart rate, regulating your heart rate, lessening muscle tensions and whatnot, and put it in a more calm, relaxed state. I'd like to add though, disclaimer, despite doing all this and despite perhaps doing everything right, by the books, depression and anxiety might still occur. It's very common and it happens to a lot of us. Some common signs to watch out for example, for depression, if you suddenly feel down most of the days, suddenly don't enjoy things that you used to like before, having trouble concentrating, sleeping, eating, feeling hopeless, or beating yourself up over some mistakes. As for anxiety, perhaps your worry might be out of control almost 24/7, creates this muscle tension, headache that interferes with your sleep and concentration as well. The important thing is if these symptoms cause severe, intense distress or interfere in any way with your day-to-day, so it might look like it affects your work, your relationship, your grades if you're students and whatnot, it's very important to seek psychiatric help. You can always reach out to your local psychiatrist, or again, if you're in California, feel free to contact me as well.
Yeah, those are great tips. I mean, to think that you only need 1 hour of exercise a week to prevent, to decrease your risk of depression. That is certainly doable. You could do 10 minutes a day, and that gets you to the 1 hour as long as you're raising your heart rate, right? And then
Definitely.
the other things you mentioned, reduce your caffeine, avoid it 12 hours before. That's good to think about, and making sure that you're looking in other things that are not coffee for that caffeine, because sometimes it's sneaky, you know.
Mm-hmm.
And then you talked about 3 hours before bed, making sure you're not eating too much, too close to bed. So you want to, and not exercising, heavily before bed. You want to give yourself time to wind down. So I think
Mm-hmm.
that's great. And then TV, I know that's big, or screens in general, right? We're so used to the phone, the iPads, and all of that. So shutting that down an hour before bed, that is awesome. And then relaxation techniques, deep breathing with your belly and your chest, and all of that. Those are awesome tips. Thank you so much. That's been helpful. Great. So now let's get into cash-based telepsychiatry, because I know that's what you do. And tell me, how is that different from the insurance-based practice, and how do patients benefit from you being cash pay?
Yes, so I think there are three main things at least. First one being personalized care. So as probably many of you are familiar with insurance comes certain restrictions, and that could impact how a doctor practice in a way. So for example, insurance might only allow doctors to prescribe medications and not allowing enough time for therapy, for incorporating all these lifestyle changes. Insurance might not reimburse certain medications that might be a better fit. And because of the extensive amount of paperwork, valuable time would be taken away and deferred from your care, from getting to know you as a person, spending a lot of time to get to know your lifestyle and whatnot, and instead getting deferred to this paperwork charting. So cash-based practice would eliminate all this and create a more personalized care on that note. The second point I think is confidentiality, because your records, your medical records, would permanently be part of associated with that insurance, and that may or may not impact your eligibility when the times come to apply for life insurance, disability insurance, things of the like. And specifically for the tele health portion of things, it might offer added convenience, right? Especially if you have a very busy lifestyle. As we know, it takes time to commute back and forth to the doctor's office, and uh, perhaps you also wait a certain period of time just to be seen by the doctors. So in contrast, in telemedicine, you could eliminate all this and just be available during the set appointment time, which means that you could use this valuable time to do your work, do your errands, do everything else that you might need to do. And you can save so much time on that too.
Yep. So save all that time waiting in the waiting room, driving to the doctor's offices, all of that time. And then you have the doctor that has that time to spend with you to go over, lifestyle changes in addition to whatever else that you need. So it's certainly a great option. I definitely see the appeal. So we're winding down here. Is there anything you would like to know about primary care or direct primary care?
Yes, absolutely, Dr. Ashaye. So I think I get the gist for the most part, but if I were to be a potential patient, what would you say is the benefit of having a direct primary care versus a traditional model?
Okay, yeah. So I really think the direct primary care model is a wonderful model. So the current healthcare system, it's sometimes really hard to get an appointment, number one. And then when you do get your appointment, a lot of times people feel like their visits are being rushed. So the direct care model is an opportunity for people to have easy access to consistent care. And consistent care is the key here, because when I see a patient and I can spend 30 minutes to 1 hour with them instead of spending just 7 to 10 minutes with them once a year, I can actually spend time, I can listen, I can understand their concerns, and then they can reach me in between their visits. So that helps them get things when they need it instead of delaying their care. I think it really makes a difference, because now they have their own personal doctor who is putting everything together for them, because health can be like a puzzle. So if you have somebody that is putting it all together, I think it makes it much easier for them to not only achieve their goal, but maintain their goal, which is usually the issue. So when people have one doctor they can see consistently, it makes it so much easier versus when they're like constantly having to see different people at different times. So I think that's the greatest benefit.
Definitely, 100% agree.
Yeah, so, well, it's been really nice talking. I've learned a lot. I really think patients, anybody watching will learn a lot from just, hopefully you can incorporate 1 or 2 things from what you've learned today, getting that, sleeping well, exercising, and reaching out for help if you do need help. All those things are really important. But do you have any parting words or any advice or anything you'd like to share with our listeners before we go today?
I do. So I just wanted to say, when you're in the middle of feeling depressed or anxious, it's so easy to feel alone, trapped, hopeless, overwhelmed, like there's no way out, right? But let's take a second and imagine with me, what if it doesn't have to be like that? And instead, you can feel empowered, regain control, be at peace, feel like your best selves again. Mental health is just as important as physical health. So if this all sounds way too familiar, please contact your local psychiatrist now. Or again, if you're in California, you can contact me. And help is just one click, one email, one phone call away.
Awesome. How can they find you? How can people find you?
Yes, so you can reach me at my website, lifestyletelepsychiatry.com, or I'm available on Instagram as well with the same handle, Lifestyle Telepsychiatry.
Awesome. And I think you have some resources as well that, go ahead, sorry.
Oh, no, sorry. Yes, I was just going to say, definitely, I offer additional free resources as well on all things lifestyle in relation to mental health. So if you're interested, you can find that in my website, lifestyletelepsychiatry.com/subscribe.
Awesome. Thank you. Thank you for sharing that. This has been a really, really great, has been good information, great information. I hope we have learned something today, and this is Connecting the Dots with Dr. Ashaye. We want to keep you informed, empowered, inspired, motivated, and so that you can achieve and improve and maintain your health goals. So look forward to seeing you next week, same time, 2:15 at on Facebook Live. All right, and our videos are also available on YouTube. Thank you so much, Dr. Pospos, for being here, and have a wonderful rest of the day.
Thank you, Dr. Ashaye. Have a good one as well.
Thank you. Bye-bye.